Hi everyone, my name is Morgan Huber, and today I'll be talking about information technology in nursing practice. I'll go over some of the different technologies nurses use every day, how they improve patient care and safety, some legal and ethical responsibilities, and a few future trends in healthcare technology. Health Information Technology, or HIT, is the use of digital systems to collect, store, manage, and share patient health information. In nursing, these technologies help us provide safer and more efficient care by giving us quick access to important patient information. They also improve communication between healthcare providers and help support clinical decision making. Some common examples include electronic health records, telehealth, and clinical decision support systems. Overall, health information technology plays a huge role in improving patient safety, coordinating care, and making healthcare more efficient. Electronic health records, or EHRs, are digital versions of a patient's medical record. Instead of using paper charts, healthcare providers can quickly access important information like medications, allergies, lab results, and medical history all in one place. This improves communication because everyone involved in the patient's care is working with the same information provided. EHRs also help reduce medication errors and duplicate testing while supporting evidence-based decision making. When patients move between different healthcare settings, their information can be shared more easily, which helps improve continuity of care and overall patient safety. Clinical Decision Support, or CDS, helps healthcare providers make safe decisions by providing reminders and alerts during patient care. For example, it can alert providers to allergies, drug interactions, or abnormal lab results before a medication is given. Computerized Provider Order Entry, or CPOE, allows providers to enter medication orders directly into the computer without having to write them by hand. This helps reduce errors caused by poor handwriting and prevents duplicate orders as well. Together, CDS and CPOE improve workflow, support clinical judgment, and help provide safer patient care. Nurses use many different information and communication technologies every day to provide safe, efficient patient care. Electronic health records allow nurses to document care, review patient histories, and communicate with other members of the healthcare team. Mobile devices such as tablets and smartphones give nurses quick access to patient information, medication references, and evidence-based guidelines while they're caring for patients. They also allow patients to use mobile health apps and patient portals to review their health information, communicate with providers, and become more involved in managing their care. Point of care technology allows nurses to document care and review patient information right at the bedside, which saves time and improves accuracy. Wearable devices and sensors continuously monitor patient health data, detect changes in a patient's condition early, and support remote monitoring. Together, these technologies improve communication, support clinical decision making, and help nurses provide safe, coordinated care across different healthcare settings. Technology has made it easier for patients to receive care both inside and outside of healthcare settings. E-health includes electronic resources like patient portals and trusted online health information that helps patients stay informed and involved in their care. Patients can use these tools to review test results, request prescription refills, schedule appointments, and securely communicate with their providers. Mobile health, or mHealth, uses smartphones, tablets, or wearable devices to help people track their health, receive medication reminders, and manage chronic conditions. These tools can encourage patients to also take a more active role in managing their health. Telehealth allows patients to meet with healthcare providers through a secure virtual visit instead of coming into an office. This is especially helpful for people who live in rural areas or have difficulty traveling because it improves access to care while allowing providers to monitor patients, provide follow-up care, and manage chronic conditions. Multimedia is another tool that can improve patient education and communication. Nurses can use videos, animations, and other interactive resources to help explain health conditions, medications, or procedures in a way that's easier for patients to understand. These tools can improve health literacy, increase patient confidence, and help patients remember information that is very important after leaving the hospital. It's important for nurses to choose reliable, evidence-based resources because patients may also find inaccurate health information online. Educational materials should also match each patient's learning needs. Before finishing patient education, nurses should always check for understanding by using the teach back method. Interoperability means that different healthcare systems can communicate and securely share patient information with each other. Health Information Exchange, or HIE, allows healthcare organizations to securely access and exchange patient records when they're needed. This is especially important when patients move between different healthcare settings because it prevents duplicate testing and reduces the chance of missing important information. For example, if a patient is transferred from the emergency department to another hospital, the receiving healthcare team can immediately review the patient's medical history, medication, lab results, and treatment plan instead of waiting for records. This helps improve communication, care coordination, continuity of care, and ultimately patient safety. We as nurses have a responsibility to protect our patients' privacy and keep their health information confidential. HIPAA helps protect patients' personal health information by setting rules for how it can be collected, stored, used, and shared. We should only access a patient's electronic health record when it's necessary to provide care. Healthcare organizations also use security measures like passwords, encryption, and audit trails to help prevent unauthorized access and protect patient information. Patients also have the right to access their own health information, so healthcare organizations should not unnecessarily delay or block access to those records. Following these guidelines helps maintain patient trust and supports safe professional nursing practice. Patients have the right to access their electronic health records, review the information in them, and request corrections if they find something that's inaccurate or incomplete. We as nurses play an important role in helping patients understand these rights. We can teach patients how to use secure patient portals to review test results, medications, visit summaries, and communicate with their healthcare providers. Encouraging patients to review their records and ask questions helps them become more involved in their care. It also gives patients the opportunity to identify any errors, which can also improve communication and patient safety. Technology is continuing to change the way nurses provide patient care. One growing trend is artificial intelligence, which can help identify patient risks, support clinical decision-making, and reduce time spent on documentation. This allows nurses to spend more time focusing on direct patient care while still using their own clinical judgment. Another important trend is remote patient monitoring, which allows healthcare providers to monitor patients from home and to detect changes in their condition earlier. This can improve management of chronic conditions and help providers recognize changes before they become more serious. Telehealth is also continuing to expand by improving access to care for patients in rural or underserved communities and making follow-up care more convenient. I think we'll continue seeing more of these technologies because they improve access to care and help healthcare teams provide more efficient care. Even with these benefits, there are still challenges to consider. AI should support but not replace nurses' clinical judgment. Remote patient monitoring requires protecting patient privacy and making sure everyone has equal access to technology. Telehealth also depends on reliable internet access and strong cybersecurity to provide safe, high-quality care. As these technologies continue to grow, nurses will need to stay informed and continue using their own clinical judgment to provide safe and high-quality care. Nurses play an important role in every stage of healthcare technology. Because nurses use these systems every day, they can help plan, select, and test new technology before it's implemented. Their feedback helps identify problems and improve the technology before it's used on a larger scale. After new technology is introduced, nurses continue to evaluate how it affects patient care and help educate other staff on how to use it safely and effectively. Overall, health information technology supports nurses by improving communication, reducing errors, supporting clinical decision making, and making it easier to provide safe and high quality patient care. As a future nurse, I know technology will be a part of my everyday practice, so understanding how to use it safely and effectively will help me provide the best possible care. And here's my list of my references I used.